Good afternoon, everyone, and welcome along to NHS Grampian's annual review. I'm Michael Matheson, the Minister for Public Health, and every 2 years our health boards have a Minister-led annual review process. Last year the board conducted their own annual review in a public session, and a year prior to that I had the pleasure of conducting their annual review. With me today I have a team from the Scottish Government, and John Matheson is the Director of Finance at the Scottish Government, who's taking part in this session with me today. Can I say that people sometimes ask me what the purpose of the annual review process is, and it should be recognised that our health boards are responsible for spending a very large amount of taxpayers' money each year. Our budget at a Scottish Government level for the health service is around £11 billion per year, and a large part of that is spent by our territorial boards, such as NHS Grampian. So clearly, as a board, they have an important responsibility in discharging the use of that taxpayers' money, but also to look at how they take forward services at a local level. And the annual review serves a process of us being able to reflect on how they have performed over the last year since their last annual review, but also to look at where some of the challenges in the year ahead may be, and how, as a board, they intend to move forward in addressing and in meeting some of those challenges. So this session this afternoon is a new part of the programme, where we have an hour which allows the public to raise any issues, concerns, comments with the board and myself, and to have a dialogue over the course of this session. What we're going to do first of all, though, is Bill, the chair of the board, is going to provide us with a presentation which will be part reflective, I understand, and also looking at some of the issues in the year ahead and how the board intend to take them forward. Following that, we'll then move to the open public session, which will be a question and answer session. So, Bill, I'll hand over to yourself first.
Thank you very much, Minister. Thank you. Well, good afternoon, ladies and gentlemen, and I want to give you a very warm welcome to the 2012-2013 annual review. But the first thing I have to do is a piece of housekeeping, that if there's anyone in the room who does not wish to appear in any subsequent photograph, please make yourself known to officers, and we'll make sure that doesn't happen. Now, I'm very pleased to welcome the Minister here and his team back to Grampian, and I'm also very pleased to see so many members of the public in attendance today. And as a result of feedback, this year's annual review is shorter than previous years, with considerable time devoted to questions from the floor. Now, in the opening section, I would like to tell you about NHS Grampian's key achievements and challenges in 2012-13, including progress with actions we were asked to take forward following last year's annual review. I'll also take the opportunity to look ahead and outline the exciting plans we are developing and beginning to implement to become an organisation that can support and care for the changing needs of the Grampian population towards the year 2020 and beyond. In advance of the annual review, we produced a self-assessment report, and copies of this are available here today and also on the website. The self-assessment deals how we are performing against key government targets, and through these, how we and our partners are working together to deliver the three quality ambitions of care: safe, effective and person-centred. In NHS Grampian, we have also adopted the values of caring, listening and improving. These values, ladies and gentlemen, underpin everything that we do. We are proactive in seeking feedback from patients and the wider population, as well as our staff, with the aim of supporting a culture of continuous improvement. One very powerful tool we have used for some time now is collecting patient stories. And at every board meeting of NHS Grampian, we take some time to listen to someone's real experiences, good and bad. This annual review gives us a further opportunity to listen directly to both Scottish Government and the people of Grampian here today. And from this we will learn how we could do better and further improve. I'd like to start by updating you on some of the actions agreed following last year's annual review. We had an extremely positive review where progress across all aspects of our business was acknowledged. We were asked to sustain performance against all national targets and standards. I'm pleased to report that we had another successful year. We performed well against the range of health improvement measures aimed at ensuring everyone has the best start in life and is able to live longer, healthier lives. We delivered in full the targets set for successful smoking cessation, child healthy weight interventions, alcohol brief interventions and cardiovascular health checks. In most instances, targets were well exceeded. Life expectancy in Grampian for both men and women continues to be well above the Scottish average. We do, however, experience the same inequalities in health as elsewhere and strive to reduce this by focusing and targeting activities in our most vulnerable communities. Over the last year, we have continued with a range of community-based initiatives to support individuals and groups with skills such as cooking. Through the Health Promoting Health Service, we are actively promoting every visit to the health service to be a health promotion opportunity. Health development workers are working with vulnerable groups. We've also made huge improvements in oral health in recent years. The NHS Board recently endorsed its Dental Plan 2020. Since 2007, there has been 169,000 additional NHS dental registrations and 80 new dentists employed. One area where progress is slower than desired is child fluoride varnishing, but we are continuing to work with dentists and parents to encourage participation. We now exceed the target for children registered with an NHS dentist. There's also a range of national measures relating to access to care, and I'm pleased to report that we have delivered in full those targets relating to access to child and adolescent mental health services, specialist services for drug and alcohol use, and the overall 18 weeks referral to treatment for 90% of patients. The Patients' Rights Act Scotland of 2011 introduced the 12-week treatment time guarantee. We are currently reporting some breaches to this guarantee, but have a robust plan in the process of implementation which will ensure sufficient local theatre and staff capacity to deliver the guarantee on a sustainable basis. In October 2012, the Board approved an access policy and in February a set of waiting times management principles. These are being rigorously applied and ensure patients are fully engaged in treatment choices and scheduled for treatment according to clinical priority. We have also had some difficulty in delivering the 62-day referral to treatment target for suspected cancer on a sustainable basis, although the 31-day target is delivered in full. We are working with other cancer centres to secure additional capacity, whilst also enhancing capacity locally and seeking to recruit key oncologist posts. Last year, a new government target for access to IVF treatment was introduced, and I'm pleased to say that within Grampian we are working with the University of Aberdeen Assisted Reproduction Unit and are making good progress towards delivering a maximum wait of 1 year for treatment. We have also continued to roll out the provision of insulin pumps for under 18s. We fell short of target on this, but are making progress, and paramount is ensuring insulin pump starts are commenced safely and consistently. Must be by time up, is it? No? No, it's not that. No, you continue. You were wishing it was, right? Ladies and gentlemen, we continue to ensure robust arrangements for controlling healthcare-associated infection and responding to healthcare environmental inspections. Our self-assessment provides more detail, but I'm pleased to report on the ongoing reduction in infection rates. Our MRSA and MSSA rate was 0.27 in the year to March 2013, which was just above the target we had set of 0.26. Our compliance with standards such as those for hand washing and cleanliness continued to be delivered. Since April 2012, there have been 3 published HEI inspections and 1 older people in acute hospitals inspection. We take these visits and their recommendations and requirements very seriously. And I'm pleased that follow-up inspections report progress and improvement. In January 2013, Health Improvement Scotland reviewed our management of adverse events and identified a number of areas of good practice, including our exemplary use of Datex. Last year, the Health and Social Care Integration Agenda was at a very early stage. I'm pleased to report that we have built on our history of effective joint working with our local authority colleagues to make substantial progress this year. Transitional leadership groups with the NHS Board and local authority councillor membership have begun to meet, and supporting work streams are being developed. I am confident that we will be ready to operate in shadow form from April 2014. And finally, I am pleased to report that in 2012-13 we met our financial targets and achieved in-year and recurring financial balance. I am sure you will appreciate that at a time of growing elderly population, advances in treatment and technology, and in the current financial climate, this is a particular challenge. However, through rigorous budget management, we were in a position to do this. I'd now like to take the chance to tell you about some things we've been doing in the last year to ensure care is safe, effective, and person-centred. We continue to be actively involved in the implementation of the Scottish Patient Safety Programme. As well as the Adult Acute Programme, we participate in the paediatric and maternity programmes. We were a pilot site for the Mental Health Programme, which is going really well, and a quality event was held in September to showcase this work. We are participating fully in the National Person-Centred Health and Care Programme. The self-assessment details the range of activities being taken forward, but these include gathering real-time experience data, registering for patient opinion, and responding to posts made. We're also using staff experience alongside patient experience information to identify improvement opportunities. We've been working with NHS Tayside in an older people in acute care collaborative. There have been 3 successful learning sessions where both boards have shared their improvements and data. Examples of work including implementing multidisciplinary team safety briefings and improving the discharge experience. The introduction of comfort rounds for elderly patients continues to work well. Ladies and gentlemen, when I'm out and about across Grampian, as I am regularly, I'm always impressed to see how motivated our staff is to provide the best possible care. It's the role of the board and the executive team of NHS Grampian to support the staff to do so. In November 2012, I was privileged to present our first ever GRAFTUS Awards. And GRAFTUS stands for Grampian Recognition Awards for Teams and Staff. 10 awards were made following a process of nomination from peers. And the GRAFTUS is now to be an annual event. I've spoken a great deal about performance against targets and how we are working to improve the experience of people who use our services. However, of equal importance is the work we are doing to plan for tomorrow and beyond. Our Health Fit 2020 vision sets out a future for health and healthcare in the northeast of Scotland based on the consistent and comprehensive application of best practice. Grampian's population is projected to increase by 7.2% by 2020, and the 65-plus age group is projected to increase from 16.8% to 19% in the same period. If admission rates and average length of stay remain at current levels, taking into account the population predictions, it's estimated that emergency admission bed days would increase by 15.9%, and emergency department attendances would increase by 7.4% by 2020. That's why transitional change is required. Over the last year, we have developed a suite of 2020 plans, including a Workforce 2020 as part of our workforce plan. The Workforce 2020 is leading the modernisation of our workforce in partnership. It includes the aim of developing a dignified workplace and anticipates the challenges and opportunities to assure sustainability. Our workforce is already changing to meet our future needs. And one example of that is the first 11 physician assistants recently graduated, and a further 14 are in training. These posts have attracted considerable national interest, and recruitment is one of our greatest challenges, given the buoyant Grampian economy and very low unemployment. We're progressing towards 2020 by focusing on two key programmes of related work: unscheduled care and planned care. Planned care covers health care which is provided on a planned basis, i.e. it's not an emergency basis. And around 50% of hospital admissions are made on that basis. But planned care is much wider than hospital care and covers all aspects, from arranging primary care appointments to follow-up at home following an episode. Our planned care programme is working to streamline processes, improve communication between primary and secondary care, and make the maximum use of technology and skills to access care as close to home as possible. A particularly exciting element of this is the development of the No Delays initiative, our locally filmed digital postcards to provide patients with information and monitoring devices to support their self-care at home. We have received a great deal of interest in this from other boards in Scotland, and we've also continued to develop the Clinical Guidance Intranet, our online referral guidance and service information library. The CGI is populated with information on health and health-related services and organisations available in Grampian. It's old information to support good referral practice, helping to ensure patients are referred to the right person in the right place every time. Our unscheduled care programme was established in September this year. The overall aim of the programme is to make a major contribution to the transformation of the health system in Grampian by coordinating activities which require a partnership approach and ensuring that there is a practical focus on moving towards the 2020 vision. In December last year, our emergency care centre opened and provided the opportunity to introduce new ways of working, including co-locating accident and emergency and out-of-hours services, and introducing new pathways for emergency admissions which admit to the right speciality directly. These changes have already led to improvements in terms of reduced accident and emergency 4-hour breaches, reduced boarding of patients, and shorter lengths of hospital stay. However, the Emergency Care Centre, which Her Majesty the Queen opened formally last week, is only one component of the unscheduled care system. Our new approach to unscheduled care focuses on organising resources around an individual's needs in the most efficient and clinically effective way. The extensive planning during 2012 and 2013 is now leading to implementation. In particular, the Clinical Decision Support Service based in the ECC became operational on the 2nd of September 2013. This will in time provide GPs, paramedics, advanced nurse practitioners, NHS 24, nurse advisors, nursing homes and other professionals with the right support to connect up care and make the best decision for the patient. This is an innovative service and is not provided anywhere else in Scotland. Our modernisation agenda is exciting, but we must move to implementation that will ensure individuals will be supported to make the best decisions about their own care and to choose the right service when they need support or treatment. An integrated and flexible workforce to improve care and service sustainably, access to patient information at point of contact, and decision support for professionals when they need it. In Grampian, we are embracing opportunities for innovation. Indeed, the delivery of our 2020 vision is dependent on it. I've already mentioned some examples where technology is being used to improve how we do things, but there are many more. However, innovation is not only about invention and new ideas. It includes adopting and spreading good practice across the whole system. We are taking forward a range of new approaches of delivery of care and actively encouraging and supporting our staff to develop and implement innovative ideas. Minister, ladies and gentlemen, it was 2 years ago that I became chair of NHS Grampian and a board member. I've been a board member since 2007. It was very much a job I wanted to do, but it's not an ordinary job, because I and my colleagues on the board are dealing with the health and welfare of communities and individuals. I often ask myself, what can be a greater reward than helping to improve people's health, especially in Scotland today, and of focusing day and daily on the challenges of delivering health care in a changing world, of using new and innovative technology, of changing cultures and adopting new ways of working in our hospitals and communities, and of doing things with people, not to them, in a person-centred environment. All of this requires a personal passion to be involved, to offer leadership and a strong commitment. And it also requires to have the determination to give people hope of a healthy lifestyle, free from illness, in a setting where early intervention and prevention are the hallmarks of what we do. And as a board, these are the expectations, Minister, ladies and gentlemen, that we seek to fulfil. And I thank you very much for giving me the opportunity to review the achievements of NHS Grampian in 2012-13. Thank you very much.
Thank you, Bill. Hopefully that presentation has given you a level of insight into the work that's been taken forward by the board over the last year and some of the issues which they'll be taking forward over the coming year as well. As part of the annual review today, I also had the opportunity to meet with a number of the clinical staff this morning to explore with them where they saw some of the challenges and some of the issues in going forward and how they feel the board is performing, and also with the staff side and with patients, all of whom were able to give me an insight on how they feel the board is performing, some of which has been reflected in Bill's comments during the course of his presentation. Now, in moving to the question and answer session, what I'd like to do here is for any individual who wishes to ask a question, is basically to put their hand up and we'll try and take them in turn. What I should say is that this public session is not an appropriate forum for dealing with any personal issues or personal complaints that an individual may have. If there is anyone here who does have a personal issue that they wish to raise regarding NHS Grampian, there are NHS Grampian staff here who would be more than happy to get the details at the end of this session and to then make sure that that's appropriately responded to. So, it's now over to you, and it's an opportunity for you to put your questions to the board on any issues that you wish to raise with them.
I am Anne Carmichael. I'm a member of the Public Forum. My interest is in GP surgery opening hours, and I've been hearing talk about possibly extending it to evenings and encouraging practices to have longer, more open availability. And I wondered what that, if that was on your agenda.
There is a desire at a national level to encourage general practitioners to look at having extended opening hours, and some GP practices have already started that process, and some resources being provided to try and help to assist in taking that forward. I don't know whether Richard maybe wants to give you some detail of how they are taking that forward within the board itself here.
Okay, well, the first thing that I would point out is that the vast majority of general practitioners, as you know, are independent practitioners, and therefore the relationship that the Health Board has with independent practitioners isn't as straightforward as being able to say as a board, we want you to open extra hours, please go away and do it. Would that it was that straightforward. But as independent contractors, one of the things that we can try and do is provide incentives to general practice to extend their hours and open their hours. And that can be done through a number of different means. One is through the contract, the national contract that exists for general medical services, but also there's the opportunity to negotiate locally with GPs around what we call locally extended services, in which we would be able to offer additional incentives, because the staff would need to be paid and the services would obviously incur costs in running additional hours, and the GPs would need to be reimbursed those costs. So, I'm picking up that there is a real issue about the availability of GP services out of normal office hours, and we will continue to work with GPs locally to try and establish those that are prepared to offer opening hours more widely. Just lastly, I would say that there is also already in place an arrangement whereby quite a significant number of general practices are open on Saturday mornings. Thank you.
Maybe just as an interesting addition to that is that there's a couple of pilots taking place in other parts of the country looking at different ways in which patients can engage with their GP. So, for example, there's a practice where they're testing out the use of Skype as a way by which an individual could have a consultation with their GP, and the GP could then determine whether they feel the patient has to come in and see them or not, or whether they feel that they're able to actually prescribe them with some treatment or medication on the basis of that contact. So I think as we go forward, not only will there be issues around opening times, there will also be issues around looking at how we can use different ways in which GPs can engage with their patients through the use of telehealth as well. Yeah.
Hugh Lawton from Murray. I would like to ask a question on waiting times. I listened intently to your 12 weeks guarantee. I know for the orthopaedic department in Dr. Gray's, it's 12 to 21 weeks. And this seems an extortionately long time. And if you're trying to reduce your waiting times, it's not happening. And I think the board is failing in that point.
I'll just say a quick word. That's an interesting point, and I mean it's an area that the board has been very much focused on, and we're giving a great deal of thought to it, and we're looking very carefully at how we can extend our capacity, because we realise we're slightly behind on that. But Mr. Carey will give you a fuller answer, but it's a very pertinent question both here and in Murray, and we accept that.
Okay, there are two main waiting time targets. The first one is what's called the 18-week treatment to referral target, whereby 90% of all patients should be treated within 18 weeks from referral to treatment. We do meet that target within NHS Grampian, but that target is an overall target covering all specialties. And when you aggregate them all, we meet the 90% target, but there are particular specialties where we find more of a challenge to meet the target, and orthopaedics is the main area where the board is challenged around the target. Having said that, we have recently invested significantly in additional orthopaedic capacity. We've appointed 3 additional consultants. We're about to open in the early part of next year 2 additional orthopaedic theatres in Wood End. And the reason that this is relevant to Murray is because we look at the orthopaedic service on a pan-Grampian basis and try and manage the capacity and the demand across the whole of the region. So we are investing significantly in additional capacity because we're not meeting the waiting time target consistently in orthopaedics. Although, again, with regard to the 12-week treatment time target, we do meet that target in 99% of the cases that are presented to the board, and we hope to be at 100% by early next year when we get the new capacity in place.
You've heard there an example of some of the work that the board are taking forward. What's also worth keeping in mind here is about how you can also make sure that those patients who are being referred to see an orthopaedic consultant are actually the most appropriate patients. So maybe just to give you an illustration of that is that in our health board, they have redesigned their musculoskeletal services, which mean that if someone has very often just say, for example, a bad back and the GP has saw them for a period of time and there hasn't been much progress made on it, and they then make a referral to an orthopaedic surgeon to review them. Sometimes the orthopaedic surgeon then has to refer them on to physio. So what they have done is they've designed the service so that the actual referrals are assessed by a team of physiotherapists first. And they identify patients actually that are more suitable for physiotherapy and they go straight there. They did that and that resulted in a 25% reduction in the amount of referrals that went to the orthopaedic surgeons, which meant that patients who were leaving their health board area to go to our health board area for treatment were actually moved back into their health board area because they created capacity. So it's important that we also look at how services are redesigned, not just about hospital consultants and theatres, and one of the things the board are looking at is how they can improve their musculoskeletal services in general. And we've got a team at a national level who are helping to try and spread that good practice so that patients who might be waiting to see an orthopaedic surgeon to then get referred to a physio, that we don't have them waiting to see the orthopaedic surgeon in the first place, that they go straight to the physio and the physio then starts a treatment programme for them. So it's important the board keep focused on how they can make sure they can improve these things, and from what you've heard from Richard, they're determined to do that, and that will involve a range of things of additional capacity and also looking at how they can redesign their services to better meet patients' needs.
Thank you. I'm from Diabetes UK in Murray. Now, I'm not sure if the board have seen the excellent document from Diabetes UK's State of the Nation report. It's a 40-page report. I'll not go read it all. But the headlines are there's 250,000 people in Scotland, 25,000 in Grampian alone, who have diabetes. That's 2.5 times the number of people who have cancer. I'm not denigrating cancer treatment in any way. But I do worry that the priority given to diabetes in Grampian, and especially Murray, doesn't really reflect the scale of the problem that you have in this area. There's 19,000 new cases every year in Scotland. For every £1 billion spent by the NHS, 800 million of that is on potentially avoidable complications. These complications could be avoided by providing greater care. Now, you've mentioned pumps for under 18s, and yes, it has improved over the last few years for under 18s in Grampian, up to 12%, still well behind many other regions. Pumps for adults are still lamentably low at 2%, which is no improvement over 3 years ago. Adults need pumps as well, but that's only a small part of it. 80% to 90% of the people with diabetes have type 2 diabetes. They need care as well. They need education. Education is a huge thing. There's educational courses available from Diabetes UK and from NHS General. Daphne courses. Locally, the girls try and run a Daphne course, but they're got to be zero funded. They're not given any funding to do this. There's just no funding available for the kind of care that people with diabetes need. Type 2 diabetics, I know many of them who have never ever seen a specialist. They're treated at primary care level by their GPs, who many GPs will admit are not prepared and not properly educated to treat diabetes. too often we hear doctors describing type 2 diabetes as the mild version. It's not. It is just as serious. You die just as well with type 2 as you do with type 1. It needs to be treated more seriously within Grampian in general, and we get the impression up in our neck of the county in Murray that it is very low priority within NHS Grampian. I'd like to hear your views on that, please.
Well, first of all, I wouldn't agree with you that that diabetes care is a low priority, and indeed, I would say that the management of patients with long-term conditions in a primary care setting is exactly what we are trying to deliver in line with our 2020 vision. If you had been a diabetic patient in Grampian 10 or 15 years ago, 90% of your care would have been delivered by a specialist based in a hospital, and you'd have spent a lot of the time driving along the A96 trying to get parked in the Aberdeen Royal Infirmary to go and see a specialist to be cared for. But actually what's happened over the last 10 or 15 years is that the pathway of diagnostic and treatment for diabetes has changed dramatically in such a way that primary care teams and general practitioners are most appropriately placed and able to look after the vast majority of a patient's diabetic care needs. The concept is that a consultant in diabetes is exactly as it's described. It's someone who is consulted with by the general practitioner if there is additional help and advice needed. It's someone to refer to if there is a particularly complex issue that a patient needs specialist care to deliver. And of course, the consultant is also the person within the diabetic network who provides training, education and support to the primary care clinicians who look after patients with diabetes primarily. So it's a different model of care than existed previously, but I would argue that in many ways it's a better model because it ensures that people are cared for locally, and it ensures that people are managed within their holistic health care needs within their primary care practice. But I can absolutely assure you that the Health Board is fully committed to the delivery of high quality diabetic care, and I do believe that we provide that in Grampian.
Richard, the gentleman asked you specifically about the matter of access to insulin pumps for older patients, those over 18. How does the board intend to go about achieving that? Because Bill and his comments made reference to the fact that you're taking further work forward to make sure that you achieve the target that was set for under 18. So how are we going to expand the provision of insulin pumps for over 18s in the Grampian area?
Well, first of all, the priority has been, as you have highlighted, for children under 18, and we've made significant progress. As we move towards meeting the needs of the under 18 population, we obviously then need to move to the adult needs. Clearly, adult requirements for insulin pumps will be determined by the clinicians themselves, and what I haven't got in front of me, and I'm not able to give you chapter and verse around at the moment, is exactly how many adults who have diabetes would actually benefit from an insulin pump. Because one of the issues is that although this the pump is seen as being a new treatment available for patients, it's not necessarily suitable for all patients, and patients need to be suitable for to get any benefit from it, and also there needs to be significant input from diabetic care nurse specialists and indeed others to ensure that patients are appropriately trained in how to use the pump and get the best benefit from it. So, we will be looking to expand the availability of pumps for the adult population whom the clinicians deem to require it on clinical grounds, and that's what we'll be trying to do. But I would also point out that we are living in an area at a time of limitations on the amounts that we can do with the resources that we have available to us, and that is just a statement of the obvious.
Good afternoon. I'm Michael Morgan from the Community Council in Newton Hill. Work has just started on the new town at Chapelton of Elsick, and we've heard from NHS Grampian that they don't have funds to provide a primary care unit within the next 10 years. Can you revisit your budget and provide it by your 2020 vision, please?
We've actually been in discussion with Aberdeenshire Council about the potential for planning gain associated with this development, and the idea would be that the developer developing the new town would set aside some funding and some resources to enable us to put the necessary infrastructure in place for that new community. These discussions are continuing. We haven't come to any conclusions as yet, but I would certainly be looking to press the developers and to press Aberdeenshire Council to look carefully at the healthcare needs and the planning gain potential for healthcare in the development of that new facility.
Michael, I mean, this has been discussed quite a bit at council level as well, as I think you know, and I think there was a meeting in Elsick very recently about this whole subject, and it did come up. I mean, I think the important thing is that there's another factor to this, that I mean, the local development plan is currently out for comment, and I mean, it would be very helpful if individuals made reference to the fact that there is an important to have that facility in Elsick, and it's particularly important, if at all possible, to have that facility in as we're at the beginning of a new town. So that's another avenue worth exploring, just to raise the profile of that very valid point. Thank you.
Excuse me just a minute. The sound in this place is so awful. I would like to speak without a microphone and just hear whether all of you can actually hear it. I'm very glad to be here today, but I don't suppose I've actually understood.
It's for the recording.
I don't think people have understood everything that's been said. From the services of the national, from the National Health Service 70 years, and more if you can't hold up with the private Grampian. I am, however, extremely concerned with the amount of information which is in the paper concerning the distribution or the amount of money which is required to increment increases in salaries, and it would appear from the information that is in the paper that it is being largely allocated towards those that receive the most money. Now, I don't know how one gets to the stage of wishing to appeal to people's good nature, but we are getting to the stage where those at the bottom of the tree, and believe me, I'm not only at the bottom of the tree, I'm strutting around amongst the roots, and I'm seeking to wonder why it is that people who get so much more than I do, so much more, infinitely more than I do, find it necessary to put even more money in their pockets, while we still have crying needs all over the board for money to be spent, and that, I might argue, would be particularly relevant to the lowest paying members of the national level.
I'm not entirely sure what story and what newspaper you were referring to. There obviously has been some issues in the press in the last sort of 36 hours around pay increases for NHS staff. Where there has been a difference of opinion from the Scottish Government side against the UK Government side around a pay increase for staff next year. The Scottish Government has a clear policy in terms of the pay increases, is that those who are on the low scales actually get a fixed amount increase in order to help to increase their earnings rather than a percentage-based increase. Over recent years, when there has been very little in the way of an increase in NHS staff wages in order to try to help those on lowest incomes. There was also the proposal for NHS staff to have a 1% increase in their wages next year, which is being submitted to the independent review body who consider these matters and then come forward with a recommendation to ministers for any pay increases. We are of the view that our staff in the NHS should have a pay increase next year. The UK Government have taken a different view on that matter, but that's a matter for them, and we'll discuss that with staff side, the unions here in Scotland as well. I presume, I'm not sure if that's the issue that you're referring to when you were talking about what was in the press.
I'm sorry, can you, I can't understand half of what you said, I do apologize. Turn your microphone off and wait for
that next year.
There's three references in the paper recently, and the first, the earliest one, was a reference where Alexei was making statements about the good news that would be forwarded into the higher paid people in the National Health Service. And certainly the most recent one was last weekend in the Herald, and the whole issue again was discussed. Now, the finer detail of it, frankly, goes right over my head. I never do understand whether people get an income because they're being good people, but of course there is something on top of that to address to address the increase in the cost of living. But when you get round to affluent paid people, highly paid people, it seems to be necessary to pay these people to ensure they keep up with each other, so that nobody moves between jobs because they don't gain anything other than it. If people would raise their hand at the end of the tax year and say, I have paid every single payment due in tax and any additional increase they've got, there's one group of people I personally would say, give them the money, and that's the people who can actually keep us alive. But at the end of the day, there seems to be still an attitude on behalf of these people that they're entitled to the goodies, whatever other people feel about it.
Okay, I'm not sure if you're referring to distinction awards which are used for clinicians that they've been frozen in recent years as well, so we've been increasing that budget for that. What I think might be useful is for someone to get some more of the details of the specific articles you're referring to, and then somebody can give you a more formal response to the concern issue which you've raised. Okay?
Thank you.
Right. Gentleman just here. Yeah.
Thanks very much. It's Steve Graham, Diabetes MCN, and Patient Forum, and a number of other bodies as well for my sins. This is something that came up this year. First of all, I'd like to congratulate Grampian and the care that I've had this year as I've explored a new patient pathway, and the cardiac people looked after me extremely well. But it also raised an issue that I was unaware of before, and that is heart failure. Heart failure is a terminal condition, and it's one that is incurable, except if you get to end stage and you're lucky enough to get a transplant, that's the only cure. Other than that, it will finish you off eventually. The thing that stands between you and a reasonable quality of life to date has been the heart failure nurse service. I was unaware of it before I went down this pathway, but now I'm acutely aware of it. It is a most excellent service, staffed by dedicated, skilled people. Unfortunately, in Grampian, somebody has decided that they needed to do a business case to decide whether or not this was a necessary service. And this business case has been prepared since about close to the beginning of the year. And during that period of time, there has been great uncertainty both for staff and for patients. The result of all this uncertainty, culminating recently in a postponement to make a decision on the final document till October, to this month, oddly enough, after this review meeting takes place. And in the interim, we've lost all of the heart failure nurse service in Aberdeenshire. And I declare an interest. I'm in Aberdeenshire, and I no longer have my wonderful service. Now, I don't know whether or not everybody's aware of the situation. I don't know whether or not all the board are aware of the situation. But somebody has dithered, has not made decisions when they could do, and just to put the nub on it, if they continue the service, it will cost, according to the calculation that's been done for the business case, around about $250,000 a year. Quite a lot of money. If they don't do it, to replace the service by taking it into primary care and the impact on secondary care, it will cost up to £4 million a year. So it's not money, so I don't know what decision this has been made on. I saw the business case. I come from a background where I can appreciate what's been proposed, and it's been supported by all of the clinicians. I haven't come across a clinician working in the field who was against the heart failure nurse service. I know that the Minister knows about it because there was a paper presented at Holyrood on a heart failure nurse service review. So I know he's well aware of that. I don't know whether or not he's seen the basis of the decision-making process in Grampian, but I really would like his comment on it, and I wouldn't mind some feedback from the board telling me whether or not they're going to approve it.
Okay, you're quite right. There was a debate in the Scottish Parliament on this particular issue, which I responded to, and about the importance of heart failure nurses and the role they can play. I'm not aware of the specific decision that's been made here in Grampian. I think the Chief Executive is better to respond to that and the time frame around making decisions on this matter. What I can say is, in general terms, is that the number of specialist nurses which we now have in the NHS over the last 5 years has quite literally exploded. We have a whole range of specialist nurses for a whole range of different conditions. Many of them that were originally established for purely dealing with one patient group have extended their role somewhat to help to support other members of the clinical team to more effectively manage the care of individuals with different types of conditions, not just talking about heart failure, but a whole range of different conditions. So for neurological conditions, etc., part of them is not always necessarily just to manage cases on their own, but it's to help to support those other nurses and doctors who may be working with patients who have these conditions and using their specialist expertise to help to support them. And part of that model is because it's not sustainable to have a specialist nurse for every potential condition. So we need to have a system which allows that to be accommodated to get the right expertise but to the right number of staff. However, there are of course certain areas where very specific specialist input can be valuable. And some of the work around cardiac care and heart specialist nurses is one of the areas which I know there is a view about the benefit that can be gained from them. But I'll ask Richard maybe to expand upon what the situation is here in Grampian.
Well, first of all, the point you made about your care, I appreciate the remarks you've made about that, and hope you're getting on well now. Yeah, the board is cited on this, and Richard has the detail, and he'll be happy to respond to your question. Thank you very much.
We have 3.24 whole-time equivalent heart failure nurses in Grampian at the present time, and these nurses are trying to support a service across the entire Grampian community. And clearly that in itself presents a challenge and makes us wonder whether or not that model of delivery is actually the right model. There are people who think that heart failure services can be better organised through primary care and through investing in developing primary care teams to support heart failure. And that is part of the discussion and debate that is going on within Grampian at the present time. The other thing to say is that the heart failure service grew from funding that was non-recurrent in nature. In other words, it was never permanently funded. It came in a number of years ago in a way that enabled us to employ staff on a temporary basis. And staff obviously were keen to ensure that they were employed on a permanent basis, but we had to consider as a health board how best to make that happen and to provide that funding recurrently. We took the view that we needed to review the service. We funded the posts temporarily through the Change Fund, and we did ask people to put forward a business case whereby we could look at the relative priority of this and decide whether or not we were in a position to invest additional funding in the service. And the submission was put to the Budget Steering Group of NHS Grampian very recently, but there were some supplementary questions and issues about the business case that we felt were needing to be answered. So the matter is still actively under review. If we do make the decision to make these posts permanent, clearly we will have to find the additional funding to pay for it. And it does bring out the challenges that we all have within the healthcare system. We've just heard from the gentleman saying that we're not investing enough in diabetes. We'll no doubt hear from others another point that would say we're not investing enough in other services. We have to make difficult choices, and we have to be assured through a process of scrutiny that the investment in this service is the right thing to do with the resources that we have available to us. But I mean, I can give you an assurance that we will get to the end of this process very soon. We're most of the way through it already, and we'll make a formal decision about what we're going to do, and we will tell the public and we'll tell the local activists, if you like, what we plan to do and why.
Lady at the back there, I think this may be our last question.
Well, it'll be a very short one. Good afternoon. Sue Kinsey. I'm on the CHD MCN, and I also vice chair of the organisation which does the Phase 4 cardiac exercise classes throughout Grampian. And Steve has just asked my question, for which I'm very grateful. Thank you, Steve. Just to say, though, that I sincerely hope that NHS Grampian will consider this very seriously. Heart failure nurses work across the sector. They may be employed by you, but they work very much within primary care, and they liaise very closely with general practice and with the staff there. There are at the moment 2 part-timers in the city and no provision at all in the county. For 5% of acute admissions and 2% of the NHS budget, they are quite a drain. But for people who are staying at home and who are living lives of some quality, the support of a heart failure nurse is vital. You've had a lot of very, very well-trained nurses who've gone on their way because you cannot provide permanent funding, and you've lost a lot of expertise in prescribing, in specialist care. And I would like NHS Grampian seriously, as the rest of the Scottish health boards appear to have done, consider this to be a priority. Coronary heart disease in its various forms is a serious problem here. We know we have hundreds of people who come to our classes and who are taking care of themselves and taking their own lives in their own hands and working. And many heart failure people would like to do the same with the support of a good heart failure nurse. So I would commend Steve, thank you for asking that, and please don't think too long, but give us a positive answer.
I think they get the message. So hopefully they'll make a decision on this matter fairly soon and then explain the rationale of their decision making in that message. Okay, that brings this public session to a close. Can I just again thank everyone for coming along to participate in this afternoon's session. I hope you feel it's given you an insight into some of the work that the board are taking forward, and it's been useful. If there are any remaining issues that individuals wish to raise, there are members of the NHS Grampian staff here who'd be more than happy to take down those details and to respond to them. Likewise, for any outstanding questions, we can get details of them and you can then get a response from the board as well. But thank you very much for your attendance here this afternoon.